As you guys requested, we're going to be talking about how to extract root canal treated teeth. So if you're a doctor who's out there and you're like, man, I'm having these issues and I want to do these types of cases, today I'm going to go over a couple of cases and I'm going to allow you to jump in and ask some questions. You can even share screen. But I wanted to go over this case because this was something that was highly requested topic that we're going to go over. All right, so taking out endodontically treated teeth is really going to be no different than any other tooth that you'll literally have to take care of, simply because it's just a tooth, right? And I know back in dental school, we didn't necessarily get a lot of training when it comes to different types of teeth, but I wanted to make sure that I give you a protocol that you could use every single time when you're taking care of teeth. Because if you're going to smile at the surgery, you're going to have this system that's going to be something that's going to be predictable, concise, and you're going to be that's going to be impactful, sustainable, and efficient. All right, those three principles that I follow anytime I take care of a case. So with that being stated, there's a case on my screen that I'll pull up. Well, let me just go through this real quick. So those are a couple things. So after you've gone through the patient's chief complaint, after you got in their medical history, after you got them anesthetized, after you allow the patient to relax, then we're going to go ahead and get started. So there is a certain way that I want you to go about taking care of these teeth, because if you don't, you're going to get out of order and everything is going to be mixed up. So if you look at this case right here, I'm going to flip my screen and I'm going to show you, this is a case that I was working on. As you can see, I have an implant here. But I'm going to go ahead and show you this cross section right here. And as you can see on this screen right here, this is the tooth that we're taking care of. And as you can see, this tooth has an implant at the site. So I'm going to move this out the way. So as you can see, this tooth is endodontically treated. And since it's endodontically treated, it's not something that you should really be concerned with. As a matter of fact, when I see teeth that are endodontically treated, such as this one, I kind of get excited because sometimes these teeth are a lot easier to come out. Now, I know this can be completely contrary to what we were taught in dental school. It's just like they're more challenging, but actually they're not, because some of these teeth that you're working on, they are so much easier to take out simply because the PDL, and if there's infection, the body's already trying to work that tooth out. And so since the tooth is already trying to be worked out, it's going to be so much easier to do, right? And so if it's so much easier to do, there's only a couple things that you're going to need to take in consideration. So the reason why would you want to take out an endodontically treated tooth? Well, it can't be treated again, right? It's already been endodontically treated, or it's a root tip. So that's the indication. Or patient is it's infected. Tooth is severely broken off at the gum line, so opposed to doing any like crown lengthening or different things along those lines, it's not something that you'd want to move forward with. Reason to extract, well, because the tooth is either going to be a site for infection, or it's going to be getting in your way to restore that area, or that area of the mouth. Some difficulties. So like I highlighted before, some people are like super scared because what happens is anytime a tooth is endodontically treated, it tends to be more hollow. When the tooth is more hollow, what happens is the tooth will just continue to break and break and break and break. And that could be a bear. But like I said, if you stick to that, I'm going to show you the tips and tricks so that you can literally do it. So if y'all have any questions, feel free to stop me. Just put the chat in there so that I can answer those questions. So the difficulties, like I said, people have the tendency of grabbing it with a forceps and it just breaks. Or the term is like, hey, it's ankylosed. Guys, I've taken care of thousands of teeth, and I could say on my hand maybe 5 or 6 teeth that possibly were ankylosed. And I don't think that the cases that I see are going to be any different than yours, simply because I'm traveling from office to office. So please, 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 if you see a tooth that you want to get better at, these are the tips for you. So we got the difficulties, materials used. All right, so let me see if I can pull this up here. So if you look at there, those are the elevators that I use. It's a back angled elevator. And those elevators, I use those for every tooth in the mouth. Those right there, you could take out, you could do tori, you could do thirds, upper, lower, any tooth in the mouth. These are the only instruments that I use when I'm taking out these teeth, simply because the tip is very, very tiny. And since it's very, very thin, it allows me to use it as like a peritome, and allows me to get in between periosteal, get in between the periosteum and the tooth, and it allows me to literally creep all the way between the bone and the actual root structure that's present. And by using these elevators, as you can see the angle of them, it really allows me to get exactly what I want out of there. So those are different things that you need to have. And these are the exact instruments that I use. As you can see, they're color coded right here. It has everything. I mean, you can tell I got my gloves on. So these aren't fake instruments that I use. These are actual instruments. You can actually tell on here because they're blunted up because of how badly I abused them over time. Which company? All right. So good question. Schumacher, you have Hugh Frady. The reason why I'm not a fan of the Hugh Frady is because they tend to be pretty thick, and I don't like that. I'm probably going to end up coming up with my own elevator system at one point, because none of those companies have really suited what I like. And so when you're doing these cases, it's not necessarily about the name brand, it's about getting the job done. And these elevators right here are amazing. Who I used, I would have to research it. Maybe that could be another topic, how to choose the best instruments online for an effective price. Maybe that'll be something I end up creating at one point. But these elevators have served me. This is my blue setup, so I've had these since 2015, and they've taken out thousands of teeth since that time frame. So good question. So like I said, this is the actual elevator. This is the actual instruments that I'm using, just to make sure we're on the same page. All right. So I'm gonna take you back to the CT scan. So as you can see right here, this is the actual case, and feel free to jump in those questions. That was an excellent question. So as you can see right here, this is the actual case that we're talking about. I got a couple others, but I just wanted to show you this from a side sectional view. Everybody tends to be scared of these root canal treated teeth, but it's just like, guys, they're really straightforward to handle, and if you follow what I'm giving you, you're gonna win it each time. So let me just come out of here. So I'm gonna pull up this panel. Typically speaking, when you're going about these endodontically treated teeth, I'm gonna give you a little hack, all right? Because I don't think anybody's ever talked to you guys on this manner before. So right here, this is who I'm taking care of. When you get, oh my goodness, I'm giving you gems today. So when you get a 150 elevator, a 150, doesn't matter what it is, a 150 elevator. It doesn't have to be anything special, just a 150 elevator. Not a 151, not a 23, not 89, not a 46, not all these little fancy stuff. I'm gonna give you simple. My purpose of this channel is to put money in your pocket, number one, and number two, give you principles so that you can follow and how to think, so I'll no longer be useful. All right. If you know anybody that needs to be listening to this content right now, today we're showing you how to extract root canal treated teeth. Forgive me, I got my printer going on in the background. So what you're going to do is this. You're going to get that same elevator I just showed you, and all you're going to do is put the elevator on the buccal and reflect those tissues on the buccal and reflect them on the palatal, right? Buccal, palatal, facial, lingual, whatever the case may be. Once you do that, typically speaking, I'm going to show you this right here. Take y'all back. So typically speaking, here is the actual tooth, right? Are you saying they're thin and strong? Oh, what do you mean by that? If you could clarify that question. I don't understand what you're saying. Oh, yeah, clarify that. That could go different ways. If you dental visits, if you could clarify that. But typically what I do is I take my elevator, and let's just say my letter opener here, and I'll do this little example, probably make it a little easier. So right here, let's just say here's the tooth, right? And what I'm going to do is this. I'm going to stick my letter opener between my nail and my thumb, right? And I'm just going to push it back, right? And I'm going to do that on the buccal and the palatal. And all I want to do is push those tissues back, right? Once I push those tissues back, then I'm going to be able to see the tooth, because y'all have heard this term before. It's called biologic width, right? Biologic width is generally about 2 to 3 millimeters. Typically about 3 millimeters, especially when we're taking out teeth like these. What happens is this: the bone does not want to be around anything that's infected, so it'll start to recede up. And so when you see a tooth like this, when you put a 150 on it, sometimes what you could literally do is have so much tooth structure that you don't need to do any troughing. And I hate that word, by the way, so don't use that word around me because I hate it. It has like a stigma behind you're just removing a whole bunch of bone. And since I do a lot of immediate implants, elevators, I got you. Once you use those, since I do a lot of immediate implant, 90% of the cases that I do are immediate implants. It's just like, I think of that and I see doctors on the gram and all these different places, YouTube, they're troughing and, doing, and then grafting. It's like, no, don't do that. What you can literally do is get that, select the tissues, get your 150 forceps and place it on the actual tooth and rotate, right? Guys, once again, if you have individuals, if you know people that need to know how to take out root canal treated tooth, please let them know. And also tell me where you're coming from as you guys jump on, if you don't mind. So when you do that, what I want you to do is you grab the tooth and all you do is you rotate. Just like that. Rotate it and hold for about 30 seconds. Rotate it and hold. Rotate and hold. Rotate and hold. Once you do that, typically every single tooth, you may have to be there for like 5 minutes just kind of sitting there holding. And literally what I'll do is I'll be watching TV. Family Feud is on or sports is on. I'll just be watching TV and the assistant's like, what are you doing? I'm like, dude, I'm doing my job. What about you? Focus. So I literally just push and hold. And if that doesn't do it, what I'll then do is I'll get my those elevators I was telling you about and put it in the embrasure and just do the same exact thing. Press and hold. Press and hold. Press and hold. And dental visits, aka the elevators, are thin and strong. So yes, thank you, from New York City. So the elevators are thin and strong, and that's why I really like it. And since it's angled, it gives you, it allows you to be in a spot that typically tissues and bone and everything's in the way. So by having that back angled, it literally is like my finger poses straight. That back angled, it allows me to get in angles get in areas that you can't with a straight elevator. And by doing that, guys, I'm telling you, if you follow this tip that I'm giving you right now, using the back angled elevator in your 150 and just be patient, push the tooth up, push the tissues up, latch onto firm tooth structure, twist and hold, Don't go towards the buckle. All we're doing, if we're doing an upper tooth, we're going to grab and rotate. Hold it. 10 seconds. 1001, 1002, 1003, 1004, so on and so forth. Opposite way. 1001, 1002, so on and so forth. By doing that, guys, each and every time these teeth come out without any issues. I would say, like I said, there was a case that I put up on Instagram the other day, and what happened was I was working on the case, and I would just tell you this. I like to be transparent because there's a lot of people just show you the good stuff. And one day I'm going to show you how to figure out how this freaking Instagram works. But anyways, I was taking out this tooth, and it wasn't endodontically treated, but it did have very long roots. And for the first time, I had to like trough on the buckle to literally get that tooth out. It was sitting right on the nerve, and I was just like, so I really want to take my time. So in certain situations, I'm okay with you troughing and removing bone. But I'm telling you, I've done like over 10,000 cases, and the amount of times that I'm literally taking out the buccal plate or the buccal or doing a buccal window is very, 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 very infrequent. And so this tooth right here, I would say if I were to classify it on a scale, I would say it is a scale of a 4. And I would put that in your hands as well, simply because there's these crowns. I put it as a 4 because these crowns, if you're not paying attention, you can knock these crowns off and then you have an issue. Another thing is the reason why I also scale it as a 4 is because this root, I want to say it is single rooted. So when it's also single root, and let's find out. I don't have to remember. Let's just go to the CT scan right here. And guys, if you want to learn how to do some of these things, I'll show you some. I'll give you some information at the end. So just stick with me, or you could DM me if you got to run because of time frame. But right here, this is a CT scan of the tooth that we're looking at right here. So what I'm gonna do is this, I'm gonna get a little closer to it. And so as you can see, this is a single rooted tooth. So it's not that big of a deal. And we're not by the sinus, so I don't think that you're gonna push it in the sinus. So you're also in a good place there. And you could look at this. Now, this is not the case. I wouldn't get a CT scan for a case like this. This is overkill. I follow the principle of ALARA, as low as reasonably achievable, when it comes to doing x-rays and different things of that nature. So it's overkill, but like I said, this is for an immediate implant case that I'll be planning for the future, or for the next early this week, that I'll be taking care of. But you can see, like, this is pretty straightforward. It looked as if the individual who did the root canal, yo, what's up? So also tell me, guys, where you're coming from, if you don't mind, just so I get an idea who I'm speaking with. But you could tell that right here, the doctor who did this root canal missed the distal or the palatal canal in this root canal that they're treating. So hence it fractured off. All right. Let me see what else I want to make sure I answer all those questions. So complications. Complications. Of course, you have your bleeding. You have bleeding, swelling. You could fracture the tooth to where, if you want to place an immediate implant, like I'm planning on doing with this case right here, I'm literally going to I want to keep that buccal plate. There's a lot of individuals that are placing implants without the buccal plate. If I could maintain it, I definitely will. Now, I will tell you this: if you haven't taken out a lot of these teeth that are if you haven't taken out a lot of teeth, the buccal plate is very thin. I would say, if you look at this card right here, if you look at this card, the buccal plate is sometimes thinner than this card. Oftentimes, I would say it's about the thickness of your fingernail. And so when you're doing that, even the principles that I'm showing you right now in terms of how to take out these teeth with the elevators and the forceps, if you follow it, the twist method, or the JW method on the twist method, literally that buccal plate will stay intact, I would say 8 times out of 10. So that's 3 out of 5. And so that's pretty good, especially depending upon the infection that's present in that area. Other complications. Sometimes these teeth could, they break off so far that you have to keep on digging and digging and digging. But, I wouldn't necessarily keep that a complication. Oh, yes, here. This is huge. This is the price of admission right here. So oftentimes what happens is, a lot of doctors, what they'll do when I come in, they want to get cute, and they'll do the do the crowns, and then they say, "Hey, Dr. Williams, can you come in and do your case?" I hate that bullcrap. So I want to make sure that you guys are covered when you decide to do these cases. So if you look right here on the CT scan or the panel, as you can see right here, it says it has these crowns. And the reason why this is a complication is because if you're not paying attention with your 150 or your elevator, what you could literally do is knock off these crowns. And that sucks, because oftentimes these crowns, depending on how long they've been in there, literally it's just a shell. And if you put any little pressure on there, these things are going to crack off, and you're dealing with 2 endodontically root tip treated teeth. And that, I would say, of anything, is going to be the highest complication there, because that just sucks. And so one thing I want you to do is to be prepared for when it happens, is let your patient know, hey, I'm working next to an endodontically treated tooth, and where we are, it could potentially have some issues. And I don't want you to have these issues. So sometimes when we're working, the crown next to it can literally break off. And if that happens, we're going to put it back on. But that just gives you more awareness to take a step back and be like, yo, let me make sure that I'm literally going to be patient. Let me make sure that I'm just going to take my time. I'm going to be patient. I'm going to take my time. And that's just saying the same exact thing, because I don't want you to be pissed off when you knock the crown off and you start sweating. Yes, walking on eggshells. Exactly. And so I really want you guys to be prepared for this when that happens. Let me think of any other complications for this right here. Anesthesia. Sometimes individuals have issues with a complication in terms of getting a patient numb when it comes to these, but for something like this, I would say a lidocaine and a septo is perfect. And I want to say I'm just a creature of habit when it comes to getting patients numb. I always like to do on the buccal, starting off lidocaine and then septo. Depending on whose office you're in, it could be a little expensive, so I want to make sure that you are being aware of that. Septocaine is a little bit more expensive here in the States than it is because it's a higher potency drug, and so more potency, it requires a little bit more. I'm thinking about some more other complications. If you have any, just throw them in the chat. I'm about to jump to questions in a second. I just want to make sure I go through my routine in terms of making sure that y'all have everything. So as we speak right now, we've gone over the indications. We've gone over reasons why to extract. We've gone over the difficulties. We've gone over the materials used. We've gone over the how, right? How, and then we've gotten into the complications. So those are certain things that I wanted to prepare you guys for. We're coming up right on the 20-minute mark, at 22 minutes. I'm going to start answering some questions. There were some questions that were already submitted to me about this case already, but feel free if you have yours, just throw them in the chat, all right? And once again, tell me where you're from. I only got one person that told me where you're from. I'm giving y'all this good information. Y'all can at least follow instructions. Golly, I may have to stop because, I mean, goodness gracious. At least tell me where you're coming from. So let me check. Let me see. All right, so let me get some water. All right, let me do this. If this information, I know there's individuals out there watching. If this information's been good, give me some heart. Give me some heart emojis. Give me something to make sure that, you know, y'all are at least gaining this information, if it's been beneficial or not. Because if I'm not, I won't go to any more questions. I'll just keep moving forward. Let me know if this information's been beneficial or not. If it isn't, I'll answer. I got 3 questions on top, and I got a bonus at the end. If y'all want me to end the live now, I'll do that. Thank you. It's helpful. Can I get a little more? That gives me one question I'll answer. Stay on a little. Okay, I got a little more. Can I get a little more, please, to make sure I'm not wasting y'all's time? Because I got stuff I got to do. Okay, that's all we're going to get to. All right. So, do you place immediate implants if they... Oh, great question. Tell me where you come from, Cal. Thank you, Bob. Thank you. I want to give you some hearts back, man. I'll give you some hearts back. I'll do this. How about I do this? I'll go. All right, I'll give you a little effect right here. I'll give you a little effect. Man, I don't like that one. Let me give you a different one. All right, here. I want you to focus on me. Do you place implants if the infection is large? I don't like that. That's getting on my nerves. All right, so no. It depends. Okay. So I'm glad you asked that question. It depends. Everybody on here, I'm going to make the assumption that you guys have completed dental school. It doesn't matter anywhere in the globe. If you finish dental school, everybody's school is roughly about the same, right? Anatomy doesn't necessarily change because I'm in one continent to the other. Like, I'm going to make the assumption that everybody is, on the grand scheme of things, that's not an assumption. I'm going to say that everybody's trained relatively about the same around the globe. Last time I checked, teeth haven't changed over the last 100 years. I don't think they're going to change anytime soon. Just jaws are smaller, teeth are larger, but at the end of the day, we're all about the same. So the reason why I say that is because I want you guys not to be focusing. Like I said, I'm not going to tell you what to say, what to do. I'm going to show you how to think. So the question was, do you place immediate implants if the infection is large? It depends. And the reason why I say it depends is because if there's so much infection and there's infection on the buccal plate, and the buccal plate's just completely obliterated, and the lingual plate's completely obliterated, I'll let you answer that question. And I'm pretty sure you guys know. Somebody answer that question, please. Please, somebody answer if there's an implant wanting to be placed, and I've seen this happen so many times. The buccal plate's completely obliterated, and the lingual plate's completely obliterated. Are you going to place an immediate implant at that time if the infection is like that? Give me a heart. Give me a 1 or 2. Give me something. Yes or no? Thank you. Exactly. The reason why I want you guys to know this is because there are individuals that are capable of placing. Thank you. You need primary stability. And the thing is, this is like, there are individuals out here that are able to fixate, do grafting from the ramus and place it on the buccal and palatal, and to have that buccal and palatal plates that can be done. But unless you are literally trained and you've done several of those cases, I would say leave those to the professionals. Like, not to the professionals, to those who have done so many more cases. So I want to give you the largest thing, and I want to bring it down. But if there's infection, in the sense that there is infection in the, let's just go back to this case right here. I'll pull this back. So as you can see, I got my notes over here. So let's just say there's infection at the apex here, at this point right here. If there's infection there and it's small, I'll curate it out. I will disinfect the area. I will use Paradex, and I will use a localized antibiotic like chlorhexidine, or I use not chlorhexidine. I use tetracycline, and I mix it into PRF and the particulate bone matter, and I'll just mix those up and put it in the site after I've completely debrided all that infection out of there, all that gook and stuff. So it depends on like and the thing is, this is like, it's hard for me to answer that question, because I wish you could show me, if you could show me like a picture, or you go live and you could, show me what you have, I could say, hey, would I do that or not? Would I recommend somebody doing that? That's probably better. And anybody could open up their screen and, I could answer that question. And I want y'all to test me. I want y'all to challenge me. See what I got. But personally, on a case like that, I would say, yeah, I would just go ahead and curate it out. Use your ultrasonic scaler to debride everything out. Then let it sit with Paradex and just let it sit. You could also use tetracycline, let it sit in there for like 10-15 minutes. Go use the bathroom, go get something to eat, go work on another patient, and then come back, and then you're ready to rock and roll. But it's hard for me to answer that question, because it's pretty vague. Because your idea of infection and my infection is I don't know how you practice. I don't know what you're seeing there. I thought I had some other cases. Let me see something. All right. Yeah. Hopefully, any thoughts on? Oh! I like this. Oh my goodness. I like this. Okay. All right. So for anybody that knows, not many dentists know about ozone therapy. So ozone therapy is really good. Not many doctors know about ozone therapy, simply because it's not something. Okay, I'll get to that in a second. So not many doctors know about ozone therapy. Typically, ozone therapy is generally, I see the doctors I work with who are SMART trained doctors. SMART is basically the acronym. I forget the acronym, but it's like the way in which you take out amalgams effectively, like without. So you do a lot. It's a lot of stuff. That's not something they necessarily taught us in dental school. But anyways, I was saying holistic type of dentistry, and like they don't place amalgams, they don't use titanium implants, and they use a lot of ozone therapy, ozonated gels, ozonated water that's ozonated. Like one of the doctors, she sells like right here. She sells like a vial like this, and it's ozone, and you put it in, and it helps out with like infections and all the different things you like. You heal it faster. So that's really good, because not many people know about that. So y'all getting gems. See what happens when y'all ask questions. But yeah, ozone. I'm not going to give y'all everything right now. I want y'all to go do some research. Next week we'll probably talk about that. And if y'all have any topics, let me know now. I will. I'll put those in. But that was an excellent question. But yeah, ozone is really good. Ozone water gel, because like I said, it allows the patient to heal up a lot faster, and they don't have to use antibiotics. I am very, very, very judicious when I use antibiotics, because antibiotics really tears up the system. Antibiotic, anti-death, antibiotic, anti-living. So I like I said, I am very I want to be impactful. Anything I do, I want to be sustainable, and I want to be efficient. At one point, if you use antibiotics too much, antibiotics will become resistant. So if you could learn other different modalities that you could use, which are pretty inexpensive, which I'm going to give y'all a lot of stuff. Like I said, I'm going to put money in your pocket. I'm going to show you how to think, and I'm going to give you principles so that I will no longer be necessary. So I won't answer all your questions like, yeah, do this or don't do that, but I want to make sure that you know how to use your brain, which everybody you've been given. The Creator gave you a wonderful brain, and I want to just unlock what you already have inside of you. So I answered that question. Hopefully I did there. Have you ever read about irrigating extraction sites with acidic pH water instead of saline? I have not. I don't want to sound ignorant, but I'll go ahead and take a stab at that. Acidic pH water. So if we go back to bacteria, yeah, perfect, my pleasure. So if we go back to, so for instance, if you ever had a patient come into your office and like, hey doc, I'm infected, you should always ask them, do you have a funny taste in your mouth? The reason why I say a funny taste in your mouth, because acid is sour, kind of like a lemon, right? And when you're producing a lot of bacteria, like pus, it's acidic. So when you want to add acidic pH water to the area, I don't know if I would do that. Once again, I'm ignorant, so I'm just answering the question the best know. And I don't want to be a disciple of ignorance. I don't want to perpetuate ignorance. And there's nothing wrong with being ignorant, guys, as long as you don't stay there. So let's be clear on that. So I'll do some research on that. Let me write that down real quick. Wait a second. If somebody, can you DM me that question, if you don't mind? I don't want to make sure I got you so I can answer that. I'll probably pH extraction sites. And the other one was, we'll talk about some ozone therapy. All right. So yeah, I wouldn't. But you know, I'm gonna get educated very soon. So yeah, these are really good questions. We're going on 30 minutes. I don't want to, if you want me to keep going. Well, I'm gonna slow it down. I'm gonna slow it down in a second. I'm gonna take one more question before we get out of here. Like I said, I got something for you at the end. Let me see. Somebody's calling me. That means I gotta go. What question should I answer? Let me do something easy before I get out of here. Post-op instructions. All right. Yo, what's good? So, post-op instructions. I want to give you an easy one, then I'm gonna let you guys go. All right. So post-op instructions. One thing I want you to do is this. Before I answer that question, let me do this. All right. So today we went over a lot of different things. We went over treatment planning. Golly. All right. I gotta go, guys. Golly. All right. They started. Could you share the instruments? All right. I got you. I get you. Hold on. Let me do that. Instruments, and we could do one on instruments as well. But I got you. All right. So before I answer this last question, let me just let you guys know. So, oh crap, I'm all over the place. Golly, so many people calling me. All right, I gotta hurry get out of here. All right. So let me real quick. Okay, so what I did is this. I have courses for all you guys that want to learn how to do extractions, thirds, implants, all the different things that we talked about today. How to treatment plan. I give you the whole kit and caboodle in this course. For the first 3 doctors that sign up, what I'm going to do is this. I'm going to let you guys personally come and shadow me. 3, I'm going to give those to you on the house. For the first 3 doctors that sign up, the link's in the bio. Let me make sure that's there. And let me see, I think it's there. If it isn't, just DM me and I'll get to you. So I'll let y'all come and shadow me where I am. Y'all see how I operate. Give me 3. Those are on the house. So for the first 3 doctors that sign up for the course, for the Platinum Smile Surgery Platinum Bundle, that gives you everything. How to take out teeth, the whole 9. It gives you everything. I'll let you come shadow me. Get 3 opportunities. Also, this offer is only for 24 hours. 24 hours. Once it's up, I'll knock off $100 off that course as well. So what you'll get is you'll get all the courses that we discussed, that are highlighted on the Platinum Bundle. I'll let you come out and shadow me. 3 opportunities. That's on us. And then for you guys staying on and asking me these questions, like I said, I'll knock off $100 more on that. The offer is only offered for 24 hours. The link's in the bio. Let me make sure it's on there. It should be on there already. But the link's in the bio. I'm gonna answer those questions. I'm gonna get out of here because I got people trying to get me. Now. Hold on. Yeah, it's on there. Yeah, so go ahead and it should be in the links in the bio, so you could just go there. It should be 3 shadowing sessions. Once you get there, click the Smile Through Surgery Platinum Bundle, and then also for the first 3 doctors that sign up, I'll give you those 3 free shadowing sessions. But then for those that watch this later, for 24 hours, in 24 hours, we'll knock up give you $100 off as well. But let me get to your question. So last question is this: post-op instructions. So a lot of people are very challenged by post-op. And I'm going to give you my simple ironclad post-op instructions that literally every patient that you treat will literally be good. All right. If you want this, hit the heart button. Let me know if this is going to be something that y'all really want to know. If you won't, I'll go to my meetings. I'll exit stage right. If I don't see any hearts, I'll get out of here because I think that I would have answered all your questions. If you don't want this question, then I'll get out of here. If you want it, just go ahead and hit the heart emojis, and I'll let you guys go. It looks like y'all are good. Yes? All right. Looks like y'all are good. Oh, somebody threw some means a heart. I don't know who that was. Do you want the... Okay. Okay, another heart. All right. Gosh, I can only get 2 hearts. That's giving y'all... Thank you. Can I have one more, please? I feel like I'm talking to my wife. Can I get a kiss? All right, we'll give it to you. I'll give it to you. I'll get, so as many hearts that y'all give me, I'll give y'all the game. So I'll give y'all one. So in terms of the post-op instructions, typically what I do is this. I tell the patient this, and this is a gift from me to you. Eat whatever you want. That's what I do. I tell them to eat oh, there's some more hearts. I'll give you some more. Eat whatever you want. I found after 10,000 surgical procedures, thirds. All right, perfect. Thirds, immediate implants, bone grafting, tori, biopsies. I don't care what it is. It's always the same thing. I always tell them, eat whatever you want. The patient's like, well, what happens if I get food in the site? Guys, the body heals from the inside out. So I haven't had any patient, maybe have 2 patients out of like my 10 years of practicing that said, hey, I got food in the side. And the last thing I ever want any of you guys to do is get a monojet syringe and start flushing the area. The reason why I probably covered it another time. So I'm just giving you the post. I could go on and on and on. I got to get out of here. So tell the patient eat whatever they want. The reason why you want them to eat whatever they want is because, and as long as it doesn't hurt, is because most people are intelligent, even the ones that you think that aren't. And if you tell them, if you give them a boundary, they'll typically stay within the boundary. But if you just tell them, don't do this, don't do that, they're gonna say, screw you. They smoke a cigarette. They will smoke some whatever they want to smoke. They'll drink. They'll literally get some popcorn and shove it in the side just to piss you off. How do I know? Because I've seen it. And just like I'm giving you guys now, I'm not telling you what to do, what not to do, but I'm giving you boundaries so that you could think. If you allow your patients to think, even the ones that you don't think are thinking, I'm telling you, patients do very, very, very well. Even kids, like it's crazy. And so tell the patient to eat whatever they want as long as it doesn't hurt. They'll say popcorn, yes. Soda, yes. What are some other? Nachos, yes. What are some other foods that y'all talk about? I don't know. Whatever. Eat whatever you want. When I had my wisdom teeth taken out, they were horizontally impacted, I was killing the food. I had salmon, had spicy rice, had broccoli, and I was just tearing it up. And I thought to myself, like, wait a second. I'm a doctor now. I don't have to literally have any specific diets. And it's like, no. And here's a little hint. Here's a little hint. Most of my cases with thirds and extractions, I do not suture. Like I'll create my flap. It's a real, it's a laparoscopic incision. But I like guys, I very seldom suture, and so I won't get into that now. I won't get into, maybe you got to ask me some questions later. But I very seldomly suture. And since I very seldomly suture, food, you would think that food galore gets back in there. But guys, it does not. It does not. So number one, eat whatever you want as long as it doesn't hurt. Then after that, no rinsing, spitting, or using any straws. And I literally tell them just like that. No rinsing, spitting, or using any straws. Don't just say no rinsing, spitting, or using straws. Show them. No rinsing, spitting, or using straws. People are like, oh, okay. Biting, if you notice that they're bleeding more than you like, get some gauze, just one gauze, just one. 2x2 gauze, just one. Fold it, and then fold it, put it in the mouth. Bite on it. If they do one of these, not doing right. Go 20 minutes at a time. Switch it out. Last one is, that's it. Take your medication. All right, guys. I answered your question. If you wanna submit your information in terms of, not your information, but if you want to submit submit a topic for when we go live next, and maybe if it's a case or something, maybe if you want to join, we could do something. But submit your cases. Just DM me. I gotta run. As you see, my phone was going crazy. I was only gonna give y'all 20 minutes, but we went 40 minutes. That's cool. Like I said, my focus for you guys is to smile after surgery. And if I have to take a little bit more time to push somebody else back, I will do it for you guys. There's a reason why I created this channel, and I want to do it even at my demise. Well, not demise, because I believe the more you give, the more you get. So once again, go ahead and go to the link in the bio. Make it a great day, and I look forward to seeing y'all next week, because I'll be here giving y'all these tips. All right, guys, make it a great one.